The word Ombud is Scandinavian in origin, and it means proxy or representative. So it's an official appointed to investigate complaints from the public. Last night, we heard from the Legal Services Ombud. Tonight, let's focus on the newly appointed Health Ombud. The malpractice claims against our government health services alone indicate patients are often failed by our healthcare system. Medico-legal claims run into billions of rands. The health department estimates almost a third of its total budget is eaten up by these malpractice suits. The sharpest example of the health system failing is the Life Esidimeni case dating back to 2015 in Gauteng, where 144 mental health care patients died after being transferred from Life Esidimeni facilities to substandard and unregistered homes. Let's meet the new Ombud for Health, Professor Taole Mokoena. Prof, thank you so much for joining us. We're chatting off air. You're a professor, you're a doctor, you're a surgeon, not practicing anymore, now overseeing the rights of patients, essentially. I want to start with Life Esidimeni because, of course, your predecessor did so much around Life Esidimeni. You know, his office was the one that established that none of the NGOs were registered, that all the deaths were unlawful. We now know, of course, that over 400 million rand has been paid out in compensation to the families, all those who managed to survive what happened with those transfers. And there's an inquest underway to see if there's going to be criminal action that can be taken. Is that enough? Is there more that you see your office needing to be done, or is that something that your predecessor set in motion and now needs to play out?
Thank you very much, Sally. As far as Life Esidimeni, of course, it was very tragic. It was a major misadventure that cost the lives of people. Our office, the Ombud's office, they did what they had to do, and out of that, the consequences that you just pointed out, that the inquest is being followed to see if there's anyone who's culpable, and hopefully, if those people are found to have acted criminally, the law will take its course. As far as the Ombud's function is concerned, I don't see anything that we need to do any further about it.
Which is perhaps a good thing, because there is obviously a lot of challenges that you're going to be tasked with. So let's hope that that does see some real accountability and not just massive payouts. But speaking of payouts, malpractice is a real problem. And I think it points to the fact that patients are often neglected, ill-treated. Those claims, of course, they go through a legal process. And I just wonder if you could explain what your role is then. If a patient believes they've been neglected or maltreated in any way, would they go to your office first or to a lawyer first? What would you recommend?
Of course, it's up to the patient what they should choose first. But when they come to us, we'd deal with the complaint in terms of looking at whether there was a transgression or failure to uphold the norms and standards of healthcare, and then out of that, there may be issues that the complainant might want to take it through other channels using legal apparatus, take them to court or whatever.
Tell us a little bit more about you, because we got to know your predecessor quite well. He got himself very involved, and he took a stand quite strongly. I know that you've been a surgeon, you're a professor, you've got a lot of skills. What are those skills that you've amassed through your career do you think you're going to use in this role? What do you see as the important things that you're going to be doing?
I'm glad you should ask me the question the way you've put it. First of all, I must just tell you that I'm a very private person. I'm also a rural boy, And we're brought up not to talk about yourself. Let others judge you, and they can talk about you, but you can't talk for yourself. But coming to the question you asked, what skills do I bring there? Firstly, I'm a research scientist as well as a medical doctor. So I've been trained in a scientific inquiry. So I think, given that we'll be looking at complaints, my research techniques and ability will stand me in good stead, no doubt. And then I'm a surgeon, and surgeons, by their nature, they take very, very serious and often life-changing decisions. And just as in a jocular fashion, if we need to chop your leg to save your life, we tell you straight, and we do exactly that. We chop your leg to save your life. So that kind of training.
Yeah, and you understand in a sort of life or death situation that decisions have to be made at critical points.
Yeah.
Often, as you say, when a patient is maybe anaesthetized. And that's a good thing, because what we don't want is a country that goes out of control with legal cases. But what we do want is a system that really looks after people who don't have the voice, people who have genuinely been badly treated. And we know that's a real problem. You know, we also know that nurses and doctors are often dealing with very difficult situations. They're not able to do their jobs properly. We saw a situation recently where newborn babies were put into cardboard boxes, not because the nurses thought it would be a good idea, but because they simply didn't have enough equipment. And that obviously also adds to the burden on our doctors and our nurses, but equally it leaves healthcare patients often treated with a lack of dignity, and often with lifelong injuries or even death. It's an enormous task because of the environment. And we know that our own health minister said we need 200 billion rand to actually bring our healthcare system up to the standards that it is required. What sort of healthcare progress are you hoping to make, given that you've got such a difficult context to operate in?
Well, Sally, it's not in my giving or my remit to improve healthcare.
Yes, I know.
My remit is to make sure that the healthcare delivers appropriately, efficiently, and effectively, and is fed across the board, regardless of status or of money or reputation or whatever. That all members of our community, they get the same. I know that we have very limited resources, but it is for the healthcare system to use those resources prudently and, as I said, equitably.
Yeah. I mean, you make an excellent point, really, that actually that's not your mandate. You care about the patients and whether they've been treated fairly or not. And when it comes to making that decision, you've got a wealth of experience. You understand the environment in hospitals. You understand the pressures on doctors and nurses. And at the centre of it, you have the patient's well-being and whether they're treated fairly or not. And that leads me to another question, because I think there's a concern, given the fact that you are an ANC member. I think you're the former chair of Chancellor House, which is the ANC's investment arm. The concern that you might hold back on making the health department, for example, look bad because of your ties to the ANC. It's an important issue that has to be discussed. What do you say to people who have that concern?
You know, I'm a professional. I'm a member of the ANC, but in my professional, when I wear my professional cap, I do what is required of me as a professional. And I'm a member of the ANC, albeit not in good standing.
Does that mean you haven't paid your fees?
Yes.
Okay, just checking.
But when it comes to my professional thing, I'm being a medical doctor and a surgeon to boot. Ethics is our mantra, and I deal with it ethically. And perhaps I must just tell you, the people who are raising this kind of thing is people who don't know me.
Yeah. It's interesting you speak about ethics, because I was speaking to the Legal Services Ombud last night, Judge Suraj Desai, and he was speaking about ethics and his concern that ethics is crumbling in legal services. Do you share his concern in the health fraternity that there's a crumbling of ethics within health? Are you worried about what you see?
I won't be as dramatic as Judge Suraj has been, that it is crumbling. But there are ethical issues. And there are rogues among us. And unfortunately, one rotten potato or tomato, it makes the whole package stink. But it is for us to root out these rotten potatoes and put them in the dustbin where they belong. That's my duty.
Fantastic. And you've got 7 years to do it. I look forward to more conversations, and best of luck to you, because patients need you to be their champion, and I wish you the best in your endeavours. Thank you so much for coming into studio to chat to us. That's your new health ombud, Professor Taole Mokoena.